Hi, good evening. My name is Christine, and today I'm going to be presenting my soap note. My name is Christine Say. I am a primary family nurse practitioner student at United States University with Dr. Maria Romero, and and I do my rotation in Long Beach, California, at Dr. Adoration Reyes' office. Today I am presenting my case of a 68-year-old Filipino male who presents to the clinic for an annual physical, medication refill, and lab work. He is concerned with increased urination and is having excessive thirst. So this case was very meaningful to me because it highlighted the impact of patient education, financial barriers to medication, as well as importance of culturally sensitive care in managing chronic conditions like diabetes and chronic kidney disease. So let's get started. This patient is a 68-year-old Filipino male who presents to the clinic with complaints of frequent urination, approximately 10 times a day, and has been having um, excessive thirst and wants to get his labs done, meds refilled, as well as an annual physical. So he said that the symptoms have begun to interfere with his work life. He works as a restaurant owner. He denies any dysuria, burning, urgency, fatigue, or blurred vision. So his past medical history includes type 2 diabetes, chronic kidney disease, stage 3 hypertension, hyperlipidemia, and gout. So the patient said that he reportedly took Farxiga in August because he had, based on his last labs, he had a hemoglobin A1C of 7%, 7. He had a creatinine level of, what was that? Albumin creatinine ratio of 1,128. And then he also had EGFR of 40. So he was given Farxiga in August of 2025, but then in December he stopped taking Farxiga because due to the cost, and he did not understand why he had to keep taking Farxiga because he felt like no one explained to him why he needed to take it. So since discontinuation, he has not been on any diabetic specific medications. The social history reveals that he does work as a restaurant owner. He works long hours. He eats a really high fat diet. He's like a Filipino diet that's very like high in carbohydrates and sugar. He drinks at least 2 to 3 beers on the weekend per week. But he does deny smoking. He lives with his wife and his daughter. He does wear a seatbelt when he goes to the car, or when he drives in the car, or when he's a passenger in the car, and he denies having any firearms at home. So family history is significant for diabetes and hyperlipidemia. His father has diabetes and hyperlipidemia, and his mother has hypertension. Both parents are still living. So he just complains of polyuria and polydipsia, but otherwise he is negative, right? So his ROS is negative. He just has polydipsia and polyuria. Objective is that his vital signs are within normal range. The vital signs are 180. He weighs 187 pounds. He's 5'8". He's 98 point. His temperature is 98.3. His heart rate was 70. His pulse was 20. And I'm sorry, his heart rate was 70. His respiration was 20. His blood pressure is 135 over 189, and his BMI was 28.4. Right. So as previously mentioned, that he did have a blood previous labs in August, and he went to the office in August, and his hemoglobin A1C was 7, his EGFR was 40, and albumin creatinine ratio is it's 1,128, which indicates decreased kidney function and increased protein in his urine. So labs were deferred today because or during the time of visit because he did consume coffee prior to coming to the appointment. he consumed coffee and sugar prior to the appointment. So the differential diagnosis that I included is type 2 diabetes with chronic kidney disease and severe albuminuria. Okay, so first, he has uncontrolled diabetes. He's supported by symptoms of polyuria and polydipsia, and he's not taking any medication. Second, he also has chronic kidney disease. So I put that as one of my differential diagnoses, which is supported by a decreased EGFR and elevated albumin and creatinine ratio. And the third, he has diabetes insipidus. Is my third differential. Maybe similar to diabetes mellitus in symptoms, but we don't know until we get a sodium osmolarity. But in order for me to narrow these differentials, I use evidence-based resources such as the American Diabetic Association, as well as the Kidney Disease for Gold Standard, the KDIGO guidelines, as well as peer-reviewed literature to help me decide what the appropriate the appropriate differential is. So since I've been using these, since the patient has hemoglobin A1C that is elevated, and then he's not compliant with his medications, and he has a poor abnormal labs from last visit, it really suggests that he does have uncontrolled diabetes as the primary differential. So my secondary differentials include hypertension, hyperlipidemia, and medication non-adherence due to costs. So my plan for him is to, when he is ready and he's fasted, for him to get a repeat hemoglobin A1C, do a comprehensive metabolic panel, do a lipid panel on him, do a urinalysis on him, do to check his albumin and creatinine ratio. We're also going to check his sodium for a sodium osmolarity in the urine, and then we're also going to check for a fasting glucose. So we're going to refill his medications. He takes 100 milligrams of losartan PO daily. He takes allopurinol, 100 milligrams PO for his gout. He also takes rosuvastatin, 40 milligrams for high cholesterol. We're going to send a prior authorization for the Farxiga. We're going to reattempt to start him on Farxiga again, because evidence-based practice shows that Farxiga does provide cardiovascular and renal protection, but we're just waiting for insurance approval, and it's better than the other medications. But if the Farxiga is still too expensive for the patient, then we're going to find alternatives for the patient, such as the GLP-1 receptor agonists, which can be considered. But it also depends on the cost and the availability from insurance. So our goal during this visit is to do focus education on medication adherence, dietary modifications, including reduced refined carbohydrates, limited alcohol intake, increased physical activity, and having a fasting, the importance of fasting prior to getting lab work done. So we're going to do a follow-up visit in a week once labs are done. Whenever he finishes, he can make a scheduled appointment, and then we're going to reassess him, and then we're going to reassess his medication. So evidence-based practice shows that, per the ADA and the KDIGO guidelines, it shows that SGLT2s, which is the category that Farxiga falls in, and ARBs for patients with diabetes, chronic kidney disease, help to slow the progression of the kidney disease and help improve outcomes, right? So a lot of the articles show that Farxiga is it's very protective of the kidney and the renal vascular system, so the cardiovascular system. So it shows because it reduces the hyperfiltration of the kidneys, so and it helps to prevent heart failure as well. A holistic approach using the Gene Watson theory is to have a trusting relationship with the patient. You know, we had first, initially the patient was upset and angry about the whole situation, but it was important that we gain his trust. We built rapport with him. We did like a culturally sensitive approach to him. We're gonna collaborate with him, and I'm gonna go send him for referrals to a nephrologist for kidney management, dietitian for culturally appropriately dietary counseling, as well as a social worker to help him find um, medication at a cheaper price, or maybe use like medication from the manufacturers. Obtain coupons from manufacturers' websites to get the drug cheaper. But we used a trusting relationship with this patient, demonstrating empathy and engaging with this patient in a shared decision making. So we saw the person as a whole individual, not just as a diagnosis, but we helped address his problems, his financial barriers, and also his cultural influences to help him live a better and improve his lifestyle. So to conclude, you know, it is very important to educate the patients. It's very important to utilize culturally sensitive care and use evidence-based management to help improve outcomes for patients with chronic conditions. So to help improve his diabetes and his chronic kidney disease. Anyways, thank you so much and have a great day. Bye.